Welcome back to Smart Family, everybody. I'm Connie Cola. You know, today we're discussing everything you need to know about diabetes. Did you know that diabetes is the leading cause of new cases of blindness among adults between the ages of 20 and 74? That's according to the American Diabetes Association. And joining us now is Dr. Eugene Shifrin from Nationwide Vision Laser and Medical Center. Nice to see you.
Thank you for having me.
You know, when we talk about getting an annual exam, a physical, we do that once a year. Getting our teeth cleaned, we do it twice a year. But when it comes to our eyes, we really only go when we feel like we can't see anymore. Why is that?
That's true. Well, we know day-to-day things, our eyes are very, very important. But unfortunately, we don't go to the eye doctor until there's a problem.
Yeah.
But many conditions that we see on a daily basis don't have any warning signs. For example, diabetes, glaucoma, and age-related macular degeneration.
And those are things that if you went and had those eye exams annually, not only would your doctor be able to gauge year to year how your eyes are doing, but you actually are kind of looking right into a window at a lot of things that you can see we would never see.
Correct. And those are conditions that can render decrease in vision over a period of time, and they can leave you blind if you don't keep up with your yearly checkups and yearly appointments. And a dilated eye examination is a painless procedure that we can do within 40 minutes or so, and we can tell you a lot about those conditions and prevent you from getting worse over a period of time.
Yeah, so for people who maybe haven't had an eye exam before, explain what happens here. You're basically opening the iris, right?
We put mild drops that will dilate your pupil. It's painless. Some people think it's fun, but it's...
I do. I love it. No, it's not bad at all.
And we use some of the our tools of the trade to look in the back of their eye, look at the blood vessels, look at the optic nerve, and determine whether you're at a high risk for certain conditions.
Right. And what you're seeing there are broken blood vessels, or what do you actually find?
With the diabetes, if this is uncontrolled diabetes, it does affect your small blood vessels.
Yeah.
Diabetes is a small blood vessel disease, and over time those blood vessels become fragile, and they start leaking blood and contents of the blood vessels, and over time that tends to progress if it's not controlled.
Yeah. Now the American Diabetes Association actually says their eyeline guideline for people who already have diabetes, you know you do, now you need to get in there every year. Explain that a little bit.
If this is a controlled diabetic, for example, in my chair, I will see him once a year if I don't see any progression. Once I see a progression, and obviously we correlate everything with the primary care or endocrinologist, we send the letters on every single visit.
Right.
But if the patient comes in and I see that diabetes is getting worse over a period of time, I may see the patient once every 6 months and definitely dictate a letter to a primary care or to endocrinologist stating that I think the diabetic retinopathy is progressing over time.
Really keep them in the loop on that. What are some preventive things the patient can do?
Monitor the blood glucose levels.
Yeah.
It's a very easy way, and you guys touched on earlier on the diet. Obesity is a big problem, so those are the things that we can control on a day-to-day basis.
Yeah. A lot of people maybe don't realize that Nationwide is actually based here in Chandler, Arizona.
Correct. We have 64 offices altogether. We have 2 medical centers and the laser center. In the medical centers, we do tend to see more diabetic eye examinations where we have more equipment, for example, cameras to take the picture of the back of the eye that helps us in aid in the diagnosis, and much more interesting equipment as well.
Yeah, lots of tools there for people who maybe are watching today and think, you know, it's probably time that I do get an eye check and an eye exam. And if you do think you maybe have diabetes also, to really get in there and get yourself checked.
I think not just diabetes, every condition that I've mentioned, you know, age-related macular degeneration. Overall, if you're over 50, it's probably a good idea to come in and just to get a good general checkup and just to make sure that you don't have any pathology that I mentioned.
Yeah, Dr. Shifrin, great advice. Thanks so much for sharing it with our audience. We appreciate it.